Heart failure. Obviously, that's a frightening diagnosis to get. But now, patients can manage the condition while still improving the quality of their life. In today's Healthier Connections report, brought to you by Hartford Healthcare, Sarah Cody takes us to the Infusion Center at Hartford Hospital, where folks find both solutions and friendship.
Healthier Connections, sponsored by Hartford Healthcare.
I noticed over a period of time, my legs started getting filled with fluid.
65-year-old Barry Williams of Glastonbury was experiencing heart failure.
It's the most common cause of admission to the hospital for patients over 65 years old.
Dr. Joseph Radojevic says the heart muscle becomes weak, not able to pump an appropriate amount of blood forward into the body, causing water retention.
The way that the kidneys hold on to fluid is by holding on to salt. So sodium is kind of the main driver of this whole process.
Williams ended up at Hartford Hospital's Advanced Heart Failure Infusion Center, where patients are administered medication through IV, which helps them get rid of extra fluid. It's outpatient therapy.
There's growing data that shows that the more time patients with heart failure spend in the hospital, the worse they do in general. And so clearly there's a huge advantage to keeping people out of the hospital.
A unique team approach focused on the individual helps patients with their entire plan of care, including diet.
Salt intake is probably the biggest thing that a patient can control to avoid the symptoms of heart failure.
Last week I made the Mediterranean pork chops and Dijon mustard. Whereas in the old days, I probably would have had a hamburger with cheese on top on a big, thick roll.
Recipes are actually shared as friendships form.
The patients interact among themselves, so that's an added layer of kind of education, which is very powerful.
The camaraderie that they receive by being in kind of a social environment in the room is very important for their well-being and their state of mind.
Patients with heart failure experience fatigue, but feel better and more active after treatment.
Their exercise tolerance improves so that when they go outside to spend time with friends or to go to the store even, they're able to do more.
With readmission rates to the hospital way below the national average, Williams believes this center is something special. He has lost 30 pounds of water and gained a whole lot of hope.
You just get out there and you keep plugging away at it. It's just a fabulous place.
Well, for more information about the Advanced Heart Failure Infusion Center at Hartford Hospital, just go to our website, foxct.com, and check out the morning section. Erica.
All right, Tim, thanks. Well, right now we're talking about a way to support the kids at Camp Current, and it is happening tonight. So to talk all about how to send a kid to camp, the campaign, I'm joined by our good buddy, Executive Director and CEO of Camp Current, Josh Reese. Josh, good to see you as always. Yeah.